What is my purpose?
You pass butter.
Oh my god.
Yeah, welcome to the club, pal.
Welcome to the Safety Doc Podcast with author, radio host, and nationally recognized safety expert, Dr. David Perrodin. Join us each week as we discuss the best and most bizarre practices in safety preparation and crisis response. Follow Dr. Perrodin on Twitter at SafetyPhD. And remember, the truth will keep you safe.
Thanks, noob. This guy gets it.
Hey everybody, this is your good friend, the Safety Doc, Dr. David Perrodin, from down here in the North Star Recording Studio, where it is a brisk 62 degrees at the moment. Southern Wisconsin, this is what it's like for spring, folks, and it's only going to be in the 50s for the upcoming week. This episode is the Return of the Mac. Now, I did some walk-up music on episode 132, but that got flagged by YouTube, and I had to cut it out. So I can't do Mark Morrison's Return of the Mac, but he's here. Charles Mack, Chuck Mack from the University of Pittsburgh Medical Center from Pittsburgh, who's going to give us face validity, is on the show. We'll get to Mac in just a second. Let's do a shout out to some of the friends of the show. One, Aaron Clary in the Clary Podcast. Check out Aaron Clary, CaptainCapitalism.blogspot.com. Many publications. He worked with Vince Barrick on The Millennials, a new book that's out, so you can check that out. Aaron Clary, hey, if you're in the Chicago area or you just need a qualified, competent, good CPA, our friend Chad Elkins. Chad Elkins CPA, hey, you can check out Chad Elkins in the Chicago area. This show is syndicated by the 405 Media out of Los Angeles, California. Check out the Safety Doc Podcast on the 405media.com. Is the League of Extraordinary Podcasters. You'll also find our good friend Aaron Clary on the 405 Media. And, hey, there's every reason to promote it and every reason for you to buy it. My book, School of Errors, Rethinking School Safety in America. This is hardback. This is hard copy. 204 pages. It's about chaos theory. It's a great book to read right now. You can buy it on Amazon, Barnes & Noble, places that sell books, right? $30. It's less than Kindle. The first chapter, how thinking about a bagel can get you through the worst day of your life. Chapters on transitioning into chaos. I worked with the best of the best to put it together, and you can get it for only $30. It's a great read, folks, especially right now in this pandemic world when everybody's trying to make sense in chaos. We talk about people making sense in chaos. We're bringing our good friend Chuck Mack on the show live from Pittsburgh. Chuck, welcome to the show.
Hey, thanks. I don't think I'm creating chaos. There's enough around that I don't have to worry. You don't have to worry about me.
There's enough around. So Chuck was on an earlier episode, and here's something that I want to share. Chuck has been one of my face validity check-ins, one of my member checks. So when all this crazy stuff really started to hit with the coronavirus, maybe around March 15th, Chuck and I would communicate on pretty much a daily basis. And I'd say, what's different today by you versus yesterday? And he would report some things like, there's some scaling up in the medical sector. People are moving out of the colleges, and whatever. And that's so important, right? To do face validity. And I had my network of people all over the world that I was checking in on. People are saying, yeah, today we're having to wear a mask if we go in the grocery store. Or today the postal carrier was wearing or had gloves on when was delivering mail and stuff like that. So trying to find out what is happening in the world. It's when you can say, I observed versus I think. That's face validity. And Chuck was awesome with that. He was giving me updates all the time, really helping me to stay informed. He's on the East Coast, but, Chuck is just really into this. He's really perceptive, really sharp guy. Again, it was on an earlier show. We talked about a lot of things from side hustles to as far as technology, knowing what you should know about technology, as far as what your employers have access to, when you're employed, after you separate employment, things like that. But today, Chuck and I are going to talk about a few things. One is what it was like for him working as a technology professional at the University of Pittsburgh Medical when this all started to unfold. What information was he getting? What was he asked to do? We're also going to talk about Chuck was given papers, essential worker papers. So he would display these if he was pulled over by the police. Why are you out here, Chuck? And he, basically from his employer, I'm deemed essential. I need to be at my job. Also, Chuck had some really cool stuff with GIS mapping coming off of his phone in the Pittsburgh area saying, here are geographic hotspots for COVID. So you might want to avoid these if you're driving around town, or at least roll up your windows, I guess. But, we're also going to have a discussion on his perception of what it looks like for the economy in Pittsburgh and how he sees that kind of rolling out into the future. Chuck is also a small business owner on the side, so he can talk about what he, what he's perceiving for his business, what he thinks a business model needs to look like in the future to even, be viable. So Chuck, first, tell us about yourself, man. You're Chuck Mack.
I wouldn't say it's that impressive, but the sports store has been shut down for the immediate future. I have 2 sets of auctions going this week just to liquidate some inventory, but I don't see me opening up till July.
All right. Any Kirby Puckett jerseys that you have hanging around?
They should be coming in the mail, the ones I showed you.
Yeah, they're awesome.
Yeah. And, I'm lucky that it's just something on the side. And, what about the old sports car stores, Yeah. It's a luxury item, any kind of memorabilia, you name it. It's not a necessity. I'm not a gas station. But, why keep stuff up if I'm not going to sell? That's the bottom line. So I want to take a few months to see how this shakes up, I would say by July and go from there. I just don't know where it's going to go from here. So I'm playing it safe. And I still have, my regular 9 to 5, which is turning into a 10 to 6 and 11 to 7 with everything going on. And
you're on call a lot too. So, let's get into that. Tell everybody, what work you do, what fields you're in, and then we'll get into picking this apart from, kind of like maybe around the middle of May when all of this started to cascade with the coronavirus. But yeah, so what do you do, Chuck?
I do IT work at the University of Pittsburgh Medical Center. It is a U.S. News top 15 hospital in the country. Very prestigious. We work in their flagship hospitals, Presbyterian, Montefiore, Shadyside, and there's a psych hospital attached to our group. So our job is to make sure every computer on the units or in administrative areas don't go down. If they go down, we have to troubleshoot, repair and replace. So we're boots on the ground. We're that link between the computer and the end user, and we do our best to try to keep as much up as possible.
So let me take this back to let's say right around March 15th. And to put that in context for everybody, around March 15th was when, we were just informed that the NCAA wouldn't be having a Final Four, tournament. There wouldn't be a 64-team tournament, I guess. The NBA had just shut down. Disney had just shut down. So it was like right then. But what was happening in your world from University of Pittsburgh Medical? What were they telling you? What were, the people you work with, your superiors saying, hey, Chuck, here's what we need you to do?
Well, first it was, I remember watching the ACC tournament, and I think it was the ACC tournament, they shut the game down at halftime.
Right.
Halftime. They didn't even get to finish the game. They're like, it was like, what are we going to do? The prior day, the days prior, think about that, when all the conference tournaments were starting in basketball. And it was like, what are we doing? They played it by ear, and all of a sudden, it just got shut. I didn't hear any decree, or it just happened. Right. And around that time, I work in, we only have all the hospitals in our neighborhood. It's the Oakland section of Pittsburgh. We have 3 colleges there, too. We have University of Pittsburgh, Carnegie Mellon University, and a little and a smaller school near Duquesne University, which is downtown. So
Okay.
the ball started rolling then. It was around spring break time, so half the kids were gone. And it was, what do we do when they come back? And they said, and the ultimate decision was a snap one, don't.
Right.
I have to go on call. They were supposed to be out Thursday night, and I went on call Friday, and I got paged in for something on Saturday morning. It was a ghost town. I'd never seen somewhere evacuated
Unbelievable.
that quickly. I think I might have texted you some. Do you see what's happening?
Yeah, you did.
Pictures with it. It's busy. It's almost like a downtown. It's you got three colleges in the same area plus 4 hospitals, and one right down the road too. There's a lot of foot traffic, a lot of pedestrians going, a lot of buses, and you name it. All of a sudden,
Wow.
that's it. It was sudden, and it was kind of like, well, something smashing into a wall.
Right.
It was sudden, and then it was pull back and more of reactionary to that. Hey, let's shut down. There was no, you can sense it coming, but it wasn't like a, oh wow, it just happened. Now what? You look around and go, all right, well, what's going on?
So how did you feel about that? I mean, because you sent me the pictures, and I remember it was nothing. It was these huge buildings and just nobody's around. And you said this is usually, a busy downtown type of atmosphere. So what were you feeling? I mean, what was your, I guess your face validity? You're seeing this. You're like, God, I've never seen this before. How did you start to make sense of that? What were you starting to prepare for? You're like, oh God, this is real. Like I've got to do X, Y, and Z. Because at that time, I don't know. I mean, from my perspective, I wasn't freaking out, but I was trying to process this information, kind of as you said, that was the smash into a wall. This in 72 hours we get hit with everything just fell down on us from information. University shutting down, NCAA shutting down, NBA, Disney, all of this shutting down. How did you handle it? And then also you're thinking, here I am, University of Pittsburgh Medical. What are we going to be in store for?
The first thing I was like, how much food do I have? Who knows if they were going to, at the time, who knew if they were going to completely shut everything down? I
got you. No, I'm right there. I thought the same thing, Chuck. I went out literally that night and shopped. I mean, maybe at 11 o'clock, I put a list together. My wife and I took, turns. She did the first round. I did the second round. Built up a pantry because I said, we got to be prepared. They could shut this down for 2-3 weeks or more. But yeah, keep going, man.
And I think it was, I didn't see the panic buying nowhere. I always stayed out of the way. I would go to way off convenience stores to find a bottle, a can of Lysol or,
right.
Or go to a little Dollar General. I'm not going to Walmart, Costco, all these big box stores when all this is going on. It looks to be chaos, and I consciously avoided that. Gasoline, I take public transit in. So it was like, well, what am I going to, I can drive in, but, I didn't have a lease or a parking spot. Things like that, just practical stuff, because my day-to-day in terms of being able to go into work and everything and being on call, that didn't change. And that I knew it wasn't going to change. I work in hospitals. I mean,
yeah.
They're going to need us, and we'll delve further into that. But those were initially, just seeing what was happening was like, all right, I got to see what I got now, and what do I do next? It was, I don't know if it was instinct or it was just trying to keep order and make sure everything I was doing personally wouldn't, would be okay, for lack of a better term, to be honest with you.
Thank you for tuning in to the Safety Doc Podcast with the nation's leading safety expert, Dr. David Perrodin, author, radio show host, university instructor, researcher, expert witness, and consultant. Powerful testimonials. Dr. Perrodin has a strong reputation as the go-to safety consultant, and he was still able to exceed our expectations. When we went looking for an expert in the field of crisis preparedness and prevention, David was the single person we pursued. Not easy stepping into the touchier subjects of life, but Dr. David pulls it off. Take a listen. Now, back to Dr. David Perrodin and the Safety Doc Podcast.
Thanks, Noob. This guy gets it.
How about from a technology side? I mean, from where you're thinking, I've got, what am I going to be watching for? Am I going to be watching for the internet to possibly start, blinking in and out? Do I need to start getting some battery chargers, for my equipment? Was there anything there that started to worry you of what if, because you know this better than I do and better than most people do, what would be the frailties of the internet that might show up if, suddenly there's a surge in users or, who knows what else happens?
I mean, that crossed my mind briefly, but
okay.
In terms of being in the hospitals, I would assume if there was this overwhelming increase in traffic or the physical networks, the big trunks can't handle it, I would see certain prioritizations, and of course the hospital will be up there. So,
gotcha.
For home users, there would be a worry, but at work, think about government, hospitals, whatever agencies, local agencies, county, city, state, I would assume there would be some mechanism to get they get the lion's share of the traffic and everybody else is down to a trickle.
Right.
So I wasn't afraid of losing the internet completely. I knew there was a chance that I wouldn't be able to do, be at home and have internet, but that's the way I saw it, I think.
So what started to happen at work? Maybe tell me about the first meeting, where you were brought into and they're like, listen, we need to start preparing in case we have an influx of patients. So this is what we need. Here's what our infrastructure looks like, which right? But here's what we need it to look like in 72 hours or something like that. So walk us through some of those first meetings that you had when people are coming in and saying, here's what we might be in store for, and you've got to prepare for it, Chuck.
Oh, I was on call the weekend that all started. So it was, they wanted to make, triage rooms. Where are we going to bring people outside of the ER? Where's there a place in the hospital we can throw one up? What are wiring, electrical, plumbing, basic infrastructure? And then it would be just like an ER unit. All the technology will be in place as it was with computers and printers and, medical devices. And we have spares in stock. All right, we'll use our spares and however they want to set up, just like an ER, we would. And that's when the whole telemedicine things. It was like, all right, well, we get these triage places in, but let's, what are the next steps? So it was a quick meeting, and they threw it up within a few days. They got the network connectivity, they got power, everything you would need to run a functioning ER. They pulled it off in about a week to 10 days, just quick. Because they knew they had time at the time. It wasn't much time, but compared to other places, they had time to get things up.
So was it just University of Pittsburgh Medical that was involved in this, or was it taking over some other buildings that were nearby, or planning for contingencies of we're going to take over this dorm or this?
There were thoughts, but it would be more for if we need to keep staff or staff can't make it home. They would have converted a couple of the University of Pittsburgh dorms into living quarters.
Okay.
Yeah. So that was talked about. I don't know how realistic that would have been, but I'm sure if things got to the point where it would have hit them more than they can handle, that plan may have come in place. I don't know. I'm sure I'm sure other hospitals around the country are like, well, we got to do similar things. In terms of, what about staffing? What about, can we get our staff to and from work? So I'm sure there was a lot of talk about, we'll accommodate some buildings, but fortunately it hasn't happened. And I don't think we're going to get to that point.
Yeah, it seems, okay, so right now in Wisconsin, in the last week, they have basically idle plans to take the State Fair Park in Milwaukee and put up temporary medical facilities with the Army Corps of Engineers. In Madison, Wisconsin, near me, the Alliant Energy Center, which is like a 11,000 seat arena plus a big exhibition hall, they were going to make that into a medical facility. They've since iced those plans. So kind of what you're saying, I'm seeing also like these plans to expand out the medical capacity have either idle or just been put on hold for now, right? Because we don't know what will happen maybe in fall. I think maybe this first wave might be through, but so, I would check in with you and say what's different today than yesterday. And you were sharing, we're scaling up, we're getting more capacity to do things, but we're not seeing necessarily an increase in people needing our services like patients and other facilities with overflow. So this was when you shared this with me, this was a turning point in my facility. You were given essential worker papers, right? You had a paper you were given from your employer. And tell me, I guess, when your employer gave this to you, what the direction was. Are you supposed to show this to police? Are you supposed to show this to somebody else? It basically indicated, right, that you're an essential employee. You're critical to the operation of University of Pittsburgh Medical. But yeah, I mean, when you shared that with me, to me, that brought it up to a whole new level of, I guess, seriousness of what was happening. So how did that happen? How did that happen, Chuck? Did they bring you in and they said, here it is. If the police pull you over on your way to work, show this or keep this in your dashboard? I don't know. What?
This happened late March was when everybody started officially, states, were officially shutting down. And what was happening was that we had a few employees get pulled over, and the cops were like, well, what are you doing on the road? And so after a few of those, enough complaints got to management where they sent every employee an email, here, print this out and keep it in your car. Just so you have a reason. You can say, hey, look, I'm an essential worker. I'm working at a hospital. Right. I need to get there. So you would just, the letter, it's almost like, showing identity papers and like, some back in the 30s.
Well, it is. It was really weird, man.
And it's like, I mean, at the time you're like, I understand, and there's other things going on. But to me, I was like, I got to keep this in my car and show my work. I get identification too, like your badge. It was disconcerting, but luckily it hasn't happened to me.
So I guess when that happened to you, okay, what did you also do in your personal life where I guess was this kind of resonating through you of like, oh my God, this has moved to a different level. Like I never thought I would be given basically these essential papers, right, that I might have to show, and that some of my coworkers are getting pulled over on their way to work. How did that change how you operated, just as Chuck Mack? And then also, I mean, were you contacting your relatives more? Were you contacting, I know you and I were in contact, contacting other people and saying, what's happening to you out in California? What's happening to you in Utah? To try to figure out, is this everywhere? Is it just here? What's the next shoe to fall? Because to me, I mean, that, when that information got to me, I was like, whoa. And I think it's eased back since then. But at that moment, I'm thinking, like, even if I drive to the next town over to get something that I need for, home improvement, am I going to get pulled over? And if I am I going to get told to go back home? And it really seemed dystopian. It really seemed freaky. But yeah, so yeah, share that with us.
No, I mean, I would keep tabs on what's happening nationally, but I'm more concerned about what's going on in my sphere, just because things were changing quickly. But luckily I have a fairly dull routine, especially in wintertime. I can't go to the gym. They close all those down.
Right.
So it was either, it's work and home and get gas and go to the grocery store. So I wasn't, doing any innocuous, anything, I was out of the ordinary. I just was, mundane. It didn't change for me except I had to keep some extra things on. And to this day, I wear my lanyard. Anywhere I go out, I throw it on just to say, hey, look. And that's my little safety blanket, so to speak. So if something happens, say, hey, look, I need to get gas, man.
Yeah. Yeah. That's interesting because one thing I do now is I carry my wallet everywhere I go, even if it's a walk. If I'm just going out for an hour to get in a walk around my town, I wouldn't normally do that before. I wouldn't carry my wallet, but now I do. Wherever I go, I always have my wallet because I figure, I don't know if I'm stopped for some reason because of whatever, to be able to show ID, or I guess it's easing a little bit now, but yeah, I was really, I wouldn't leave the house unless I had my keys, my wallet, and early on, even a battery pack, a small battery pack, so I could charge my phone up. And that's just kind of where my thinking was, but wow. So Chuck, tell us again how this started to unfold. How about people at work? Did you have anybody you worked with who kind of lost it, who couldn't process it, or really struggled, and it just, how did that go down? With the people you worked with, how were they processing this?
I didn't see any panic. Maybe it's just me not sensing it. I think people over time are like, well, we're here, but our next goal was to get as many people out as possible. How many people could telecommute? So how do we get equipment into these people's hands? What are some tools we can use for them to be at home yet still be online and working? So over probably a course of not even 3 weeks, tens of thousands of employees they managed to get working from home.
That's unreal, man.
And it was a huge feat. And it went fairly smooth. I don't know if there was a plan that I didn't know of that said, right, hey, look, we can do this. No, but there's some technologies within enterprise environments where you can do remote work. It's been around. It's been around for who knows how long. I remember the whole telecommute. Yeah, let me telecommute back in the late 90s, early aughts.
Oh, right.
Yeah, telecommute. But now with everything under the sun, Skype, Microsoft Teams, Google, Hangouts, whatever. The people who don't need to be there, let's keep them out of ground zero. And I'll tell you what okay. Though. Sorry to interrupt. It was different. When I go on call and I get paged over the weekend, you figure it's like light traffic or whatever. But once we got everybody working from home as possible, it was, it looked like a weekday was like, I'm here on like a Saturday afternoon.
Yeah. That's crazy.
Yeah, it was a big effort. We helped support once people were able to get, situated with work from home. We set up a team. We broke up all of our PC support, and we said, hey guys, you guys focus on the work from home people, and just you get to work from home too. Just focus on the people working from home. And then we had the rest of us who stayed in. They try to get some sort of rotation with our teams, where it'd be like 2 weeks on, 2 weeks off. But another thing I thought was it didn't split. The rotation broke. Within our team, we had half the people, hey, I want to work from home. Yeah, I'll take care of remote users. And the other half was like, you know what? I'm not going to be cooped up. That was me. I didn't want to be cooped up. I'd probably go stir crazy. Right. It's been what? It's just May. So think about probably 6 weeks of that stuff. would be a rough guesstimate. 6 weeks. Oh, so it's to me psychologically just going to be able to go to work. It just like, it helps break up the day. I remember, my parents were retired, and my mom calls. This is 3 weeks in. She's like, I don't know what to do anymore. We can't go anywhere. I don't know what else to do.
No, man, you're right.
I'm not going to be, if I have an opportunity to get out, I will. I mean, it sounds selfish, but it worked out. More people were comfortable working from home. Half my team is doing that. And I'll be boots on the ground, it's coming anyway. So as long as I can, keep some semblance of normalcy, which was big to me.
Right.
It was big. I'm glad things shaked out the way they did, even though they had all this grandiose plan and we'll rotate everybody, but nah.
No, I get it. So if somebody, somebody's working from home, or they anticipate that they might be working from home in fall, like maybe they're going to come back to a work environment. Let's just kind of broaden this out to a macro perspective. What would you recommend to people who could potentially be told by their employer, hey, we want you to work at home for the next 6 months, and they're not kind of ready for it, right? So what would you tell them as far as like what equipment they should have? Is there a certain router they should be investing in now? Are there certain skills they should be picking up just to make that transition easier for them? And my question, I think, is a little bit leading because I anticipate, we'll start back with in-person stuff, which we've already started to seen to some extent, right? But I think in fall we're going to have another shutdown, a nationwide shutdown. That would just be my anticipation. So from what your perspective, what would you recommend to everybody listening of saying, hey, like have this maybe for your, even like keyboards or monitors or Wi-Fi or whatever, or just a few things you can pick up now for some skills, which if you do end up being home for 6 months, because of a second wave, this will just make your life a lot easier. So for everybody listening, I think everybody's like tuning in right now. They're like, yes, tell me, Chuck, what are the things I could do, or what are the pieces of equipment I could get, which will just make things better for me?
If you're going to do a lot of working from home, it depends on what equipment you want. I couldn't see myself having a desktop. Get a nice solid laptop. As for internet communications, your local providers should be sufficient. I'm on Comcast right now, and it's worked fine for me. I wouldn't expect Comcast or Verizon or any of these other providers, provide you with bad internet or equipment. The router I have is my cable modem. It just runs through there, and everybody has the same setup. It would just be, I need to get online. That will be on the company. Your company has to provide you with some sort of VPN access, some sort of instant messaging, video conferencing. Where a lot of companies now have Microsoft Teams, and they can run Cisco VPNs. They could get there. It's just get a decent laptop. I'm an HP and Lenovo guy. This one, you're not going to spend $1,100 on, but you get a solid HP laptop for about $400 or $500 brand new. I know some people that we know wouldn't do that, but
right. I know one person we know who would not spend more than $50 on a laptop, but yes.
Make sure it has a integrated camera. Most of them do, and they run it at least 720p. Mine does. I'm using my laptop's webcam, and these $30 Logitech headphones. They're nice to keep the outside noises out, and you can run your meetings as without having your kids running around saying screaming. You won't be able to hear that, so you have a little bit of privacy. That's essentially it. And whatever job you can do remotely, it might stay permanent. I don't like that fall stuff, but I think, unfortunately, you're right. It's going to be easier for them to start locking stuff down when the weather gets cold. We're going to see, it's going to be interesting coming up in the summer how that's going to shake out. Then again, where we live, we're in the Midwest. You know, I'm technically in the Midwest. Spring hasn't been here.
No, Chuck, the last 2 days have been 70 degrees. So
that's
today, my daughter and I did a bike ride, and then in the afternoon, it's like 25 mile an hour wind sustained, and then gusting like 30. We got a kite out that she has, and we went up in back of our hospital complex, which was built about 10 years ago. There's big fields, and she's flying this kite. And you've got to really hang on to this thing. I mean, the wind is pretty intense, but the way, the winds are coming in because we're about to hit another cold streak of 5 consecutive days of 50-degree weather and rain. So as you said, our spring is really delayed here. And psychologically, I'm kind of worried because as there's something called finite voltage. Finite voltage means that people... So it's a term from World War II. They studied infantrymen. Psychiatrists studied infantrymen. They embed it within these groups of infantry soldiers and said, after like 200 days, you were either killed, you're taken into prisoner by, your enemy, or you had a mental breakdown, one of those three. But if you also look at civilian morale, there were studies on civilian morale. Many civilian morale studies say you can go about 90 days in a civilian population under stress of, like, whether it be war or pandemic or something to that effect. After 90 days, if things don't change substantially, you lose it. So what would happen, like during World War II, is after 90 days, the government would say, now we're in phase 4 of whatever, of this initiative, and now we're in phase 5. And they would always change things up, even though like not a lot changed, but they would just get people to think it was a new phase, because after 90 days, people start freaking out. So as you're saying, like right here, things are shut down in Wisconsin, I guess, until May 25th, and it could be extended through our governor. And the weather's not been good for the most part, so we've been inside. So if we don't have a break in summer and people hit fall, and then fall gets to be lockdown, I think psychologically, that's when people are going to really start losing it. But yeah, oh my God, it's...
A must-read for parents, teachers, and taxpayers. Dr. David Perrodin has written the most honest book about the $3 billion school safety industrial complex. Attorney James Sibley proclaims, a brave demonstration of speaking truth to power. School of Errors rips the lid off the billion-dollar school safety industry. Using real-world examples of successful responses in desperate situations, David contrasts the expensive window dressings pitched to panic parents with the inexpensive and effective approaches proven to actually work. Read this book before you let your school waste another precious dollar on meaningless safety theater. Buy the international bestseller, School of Errors, Rethinking School Safety in America, now at Barnes & Noble or Amazon.
Yeah. This is our 2 days, Chuck. This is our 2 days of warm spring. We're gonna be smack dab and back
to this crummy reality of it's not gonna hit 60 here for like 2 weeks. I'm like,
yes, I'm with you, man. We have a wood fireplace upstairs, and I burn through about 11 cords of firewood a year, and I got a little extra this year. It's right on the other side of this wall, actually. And I still have maybe a cord and a half left, and I've been reluctant to clean out the fireplace and kind of shut it down for the year, because I just know we're going to have days coming up here in May, which is crazy, right? We're going to have May, weather, which is going to be dipping down in the 30s, where I'm going to have to fire up, the fireplace and let it burn for a day because it heats part of our house. It's just insane. And so psychologically, Chuck, let me step through a few things you stepped through with me. One is they were also sending out to you on your phone. There was a global information system, or basically a map of the Pittsburgh, Allegheny County, right? And it would say, here are COVID hotspots based upon what testing. Tell me what that looked like, how you got informed of that, and was it basically meant to say don't travel to these areas? But how would I guess what was it useful to you? Because I'm trying to figure out, like, as I'm driving, like, this is good to know, I guess, if I'm going to go over here for gas or groceries, if this is a COVID hotspot. But on the other hand, I'm like, I don't know if this really helps me at all. So you're showing that GIS data, which is getting down pretty incremental. So anyone listening, like GIS, Global Information Systems, think about like Google Maps. So like Google Maps, you can type in your home address and it'll be you can find a satellite image of like where you live. So what was happening, Chuck was sharing out, is GIS data was being shared of saying certain parts of the Pittsburgh area had more dense identified COVID-19 people. And so this was public knowledge then. So, but I guess then what did you do with the knowledge that's being shared with you? Or was it alarming? Was it alarming to other people? Did you have to like explain this to other people as they started to get this stuff of what this really means? Walk me through that. Yeah.
It was in the web version of our local paper. And
Holy smokes!
Yes, it was in an article, and it's like, here's the link for the GIS information on Allegheny County, which is where Pittsburgh's located in. And it was great for a week. I looked at it like every day. I was like,
right.
Look at this. I'm zoom in and
right.
look at this neighborhood right here. It has this. And then after a week, the novelty wore off. I was like, yeah, everything's becoming more concentrated. So why even bother?
Right.
I mean, it was great. It was great at first, but then, it just wore off. I was like, yeah, I get this. Oh, look, more places are turning blue.
Can you imagine being a realtor, Chuck? Can you imagine? Yeah, you're trying to sell houses, and people at the same time are bringing it up, and they're like, yeah, no, this area we're not going to deal with this right now. I don't know. I'm just. So you said it kind of had this numbing effect, right? After a week of kind of like, so what, right?
It was more like, this is great little fun for a while, but I still have stuff to do.
Right.
It's my goal is to try not to worry about what I can't control, and you're not going to control something like a virus, or look at any plague going back the last, I don't know, thousands of years, something you really couldn't control. You can mitigate through your own. So I was like, this day is great until it wasn't.
Right.
It's just going to keep going up, and I'm not going to see any leveling off. There are graphs and everything. There's so many, so many ways to get the information to begin with, that it was like that little pinprick. All right, that's a little information overload. I know what I need to know about this. Thanks.
So I guess. Yeah, when that information is coming out, so as a technology expert that you are, I guess because I'm looking at that and I'm saying, yeah, I guess it's kind of useful, but at the same time, I'm kind of like, I don't know if it has any use whatsoever, because, what am I supposed to do with this? Am I supposed to like change my whole route through town? Am I supposed to alter my shopping? But what if people aren't delivering? What if truck drivers are delivering goods to this store, which is in this hotbed area? Will it change like that? Are they not going to deliver to this area? So give me your thought on that, because I think a lot of data like that started to come out. And when I look behind it, when I tried to figure out, I'm like, what is this really, how does this help us? Versus just getting people more worried. Because again, I'm trying to figure out someone driving down a road, and then they're like, GPS is saying COVID area, please turn left. COVID area, go straight 2 miles to. These are the things that are kind of coming up in my mind, and I'm just like, why even tell people this? And not only that, Chuck, I'm wondering too, like, so imagine like you have a house or apartment building that somebody was staying in who has identified as positive COVID-19. Is this something now that becomes public information that someone can just find on a GIS search and, Google Map search? It can honker down to the block or the house. And how do you sell a house that's maybe somebody lived in that had COVID-19 2 years ago? Or some people are like, I'm not going to buy this because I'm immunocompromised and stuff. All these weird things start to come into my mind. And I'm not the only one, I guess. Other people had some of the weird thoughts too of like, what is this data really supposed to tell people? Because, you're intellectual, Chuck. You can you look at this data, you can understand this, but a lot of people are just saying, oh, big blue area, guess I'm not going there.
Yeah, well, I don't have a choice.
Right.
I don't, and maybe that's my own maybe that's the situation I'm in. I don't have a choice. What am I going to quit my job? I could do the work from home thing, but do I drive myself crazy? Do I quit my job or just go with it? So I chose that go with it option. And to me, it became, so what? And I just have to mitigate and do what I have to do to be as safe as possible. So none of these numbers really have a bearing on me right now. I'm not saying they won't, but right now through this whole thing, it's a little nice nugget to have. But I got to deal with it anyway. And there, doctors, nurses, whoever, the people that housekeeping in the hospitals,
right,
the people that transport patients, the people, food service workers. You have all these people that are tied to it, and we have to be here.
So what was the biggest IT challenge that you faced? Was it like number of hotspots you could develop? Was it getting people access? Was it getting people trained? Yeah, tell me about the biggest IT challenge that you're like, this is, or I guess what you anticipated. Maybe it didn't turn out to be the biggest IT challenge, but right away up front, you're like, this is going to be the one that's a big mountain for us to scale.
Along with the remote work, the next big challenge, we got to ramp up telemedicine, many times what, the normal rate is. And there were initiatives we had to get whatever we could get our paws on, iPads, laptops.
Yeah.
Just because hospitals are limiting visitors. I mean, it's all you can't see. It's not like you can't see your family. So, iPad with FaceTime is the best way to go. And then for the doctors that, do telemedicine, we need to know each unit throughout every hospital in the system needs to have a laptop. It has to be set up, and telemedicine has to be ramped up in short order. Testing, acquiring equipment. That was the next biggest challenge.
Okay, so do you see that as telemedicine is kind of being like here to stay? And I think I'll lead this a little bit with anticipating that there could be a second, a third wave, and things like that. Do you think we've pushed into this telemedicine era, like that we are officially there now, at least in the early stages of saying, yeah, I mean, we're going to be buying more iPads, more mobile devices, we're going to be training our docs, we're going to be equipping our docs to be doing, and nurse practitioners, whatever, telemedicine. Do you think, I guess in the last 45 days, we've been catapulted into this, and this is where things are going to be going forward, that we're going to have big telemedicine components of healthcare?
Yeah, the initiatives aren't going away. I mean, if you put the infrastructure there already, what's the point of taking it down if it's going to be effective? And the amount of telemedicine visits we've had have gone up, I would say, 5 to 10 times, I would think, what we normally have, because we have the infrastructure for it. So if we invested in the infrastructure and it's working, it's not going to go away. I bet in the grand scheme of things, at least where I am, they're going to fold it into just normal practice.
Yeah, I actually like that, because I think it was time to do that. And something like this event, the coronavirus event, needed to happen to move that idealized design forward. So Chuck, tell me your thoughts on, information tracking, because it's been pretty open now. Well, it was first the Israeli government was saying, hey, we're tracking everybody's phone information, so we know where you're at. And the second part of this comes in with, the U.S. government is starting to come out more and say, we're tracking anonymous information from cell phones to see how many people are out and stuff like that. But what's your perception on, I guess, tracking people, especially people who might have, COVID 2019? Is this, and this might bring you into a little bit of a speculation range, but do you think people should just anticipate that they're going to be tracked every time they have their cell phone, especially if they've taken a test at the hospital? Hey, you're COVID-19 positive. I guess I'll share a little bit of a lead up to that. So we have somebody in our neighborhood, a family that had been quarantined, and the health department told them, we're tracking you. We're tracking your cellular communications, your vehicle GPS. And there wasn't even a question. They didn't need to give a permission or anything. They just said, we're tracking you. And they also said, we're going to look forensically 14 days into your past to see where you've been. They were in another state. That's why they were quarantined here. And we're going to see who you're close to, who you're interacted with, and we're going to share that data. I guess I'm not trying to paint this as something as a conspiracy theory or anything that's really a very dark, scary concept. But I guess what should people be aware of as far as confidentiality, privacy with cell phones, and what might have changed here in the last 45 days, the coronavirus event, and what people should be aware of as far as like privacy, tracking? What is the capability of some of that stuff?
They're doing it now. I mean, right. Look at this targeted ad. All right, do a little experiment. All right, say you and I talk about, just talking, we're, in the same room and our phones are there. Let's talk about, I don't know. I got to get my car fixed. And both of our cars are broken. So I got to get this. I need oil, I need fluids. I need this. We talk about our cars for an hour. The next day you look, pull up your YouTube app on your phone and you'll see ads. Hey, look, O'Reilly Auto Parts. It's happening already. I mean, it's there. I'm not saying I'm for it, but the infrastructure is there already. And I hope that it doesn't come down to that. It sounds, kind of Orwellian to me.
Right.
I'm sure they would find some slick way to do it, but I really hope it doesn't get to that point. So you're stuck with your two options: bring your phone with you, or you don't. I don't know if there's much to do on a personal level at this point. You could be an activist, say, hey, you can't do this. The average person can't be. And I my phone goes with me, wherever I get my phone and wallet. Everywhere I go, they go with me, and that's not going to change.
Oh, absolutely.
They will track me if I leave my phone at home. But it's a personal choice. You either do it or you don't. And I wish there was a different way, but I'm just seeing it realistically. I'm not trying to be pie in the sky about it and, liberty and freedom to do this. The reality is the reality. And you just either have to, deal with it. I wish I had better advice for people, but, what are we really going to do? It sounds kind of pessimistic in a way.
Sure.
But it's roll with the punch at this point. Although I can see there's going to be a breaking point at some time. I don't know. I just hope we don't have like entire neighborhoods up in flames coming like November,
No, right. Yeah. And I've seen the stuff on the 5G towers, right? Where some people in England are torching the 5G towers,
yep.
So they're burning those up. So one of my friends was talking about, so let's say like Ancestry 23 or whatever the hell these sites are where you can figure out, where your ancestors came from. But he was saying, what, if all this information kind of gets fed into a national database, what if there's a genetic predisposition that, you or I have for COVID-19 or COVID-20, whatever the new version of a pandemic is, and we get contacted by our employer and they say, yeah, listen, you need to stay at home in quarantine and we'll let you know when you can come in. But you could do that. If you know people's genetic codes and if you figure they're predisposed, you could tell them that, hey, you can't be coming into work. You can't leave your house for 6 weeks, 8 weeks, 10 weeks. And it could be while everybody else is kind of doing their thing. And to me, that conversation made sense. Logically, you could see that. You could see where there could be some report and they could say, listen, yeah, your genetic code means that you're more predisposed to COVID-20 or COVID-21. So we need you to stay home. But how do you work then, right? How do you, I guess you can do remote work, but what if some people can't do remote work? How do you live your life if 3 months out of the year you're at home and you can't interact with other people, or if you go out in an environment? I guess too, Chuck, I've seen this thing where Ford Motor Company their employees wear wristbands now where if you get within 6 feet of another employee, it vibrates to let you know, hey, you're not social distancing. What do you see as the technology, I guess, possibilities and maybe likelihoods of those types of things coming into play? Because everybody's planning for, I guess, this whole pandemic thing, whether we like it or not. It's where everybody's mind is right now. Everybody's mechanical engineers are designing new buildings, designing, door entrances to be without contact and all of this stuff. Give me your take on where the technology might open doors, might take people, might take our society in the next, 6 months.
Thank you for tuning in to the Safety Doc Podcast with the nation's leading safety expert, Dr. David Perrodin. Author, radio show host, university instructor, researcher, expert witness, and consultant. Powerful testimonials. Dr. Perrodin has a strong reputation as the go-to safety consultant, and he was still able to exceed our expectations. When we went looking for an expert in the field of crisis preparedness and prevention, David was the single person we pursued. Not easy stepping into the touchier subjects of life, but Dr. David pulls it off. Take a listen. Now, back to Dr. David Perrodin and the Safety Doc Podcast.
Thanks, Noob. This guy gets it.
Wow. That's a heavy question. I said before, the technology's already there. If Ford's doing his bracelet, what's going to stop your local municipality from, hey, we bought thousands of these monitors, wear these and make sure you social distance. It can happen.
Right.
I hope it doesn't get to that point, but I can't call it. I know that the technology's there. If they're using it, and it could expand it. They're going to. They'll find a way. It doesn't end up like this, but it's there. Yeah, you can say or they'll have some fine, or you get fined if you don't wear your bracelet, or something, or if you're caught and do this. I don't know how it's going to play out. I just know the technology's there and it can probably be expanded.
Wow. Hey, so Chuck, you're also a small business owner. So can you tell people some of the things that you sell?
I sell a lot of sports memorabilia stuff, and of course, these frivolous things might be coming to an end. I said, I have a couple auctions up in the next 2 weeks, and that's just to clear inventory. And I'm shutting down completely again. I shut down in the middle of March. I said I pulled the plug then. And it's getting to the point people are starting to open up a little bit. So I'll take my little window while I can, and I'm going to shut it down again, and I'll do it month by month. I don't know how small businesses like your hair places, those,
give me your
those
take
type
on
of
that.
things. I've had a haircut in over 2 months.
Same here, buddy. Same here.
I have dry cleaning. I allow a couple luxuries in my life. I get my shirts dry cleaned, and I get a haircut every 2 weeks. So I've had the same number of shirts at the dry cleaners for 3 frivolous things. That in the gym too. What about all these people who work and they're stuck there? Restaurants can skirt it, with all the takeout stuff. If you're a gas station or a service station, yeah, I mean you can, but what about all these little mom and pop, little boutique shops, for those people, what do? They can't sell their wares. They can't, you're in a, I guess, luxury. I get by with it, where my hair being cut, I'll deal with it. But, those businesses that support our, frivolity, I can't believe I'm getting my haircut frivolous. Isn't it?
Right.
But yeah, those people aren't functioning, and and that's something you can't stop. You're going to shut all the barber shops down, and track people for social distancing. Is that what it's going to come to? I really hope not. I like to get my hair cut sometime in summer.
Right. So I guess what's closed by you maybe on a permanent basis? Have you seen anything, in signs up or else been notified or newspapers saying, hey, this is permanently out of business now. Like they're not coming back.
Not yet. I'm sure I'll see them over time. Let's see how the summer goes. But
yeah,
I've read stories about, this business is closing. Yeah, I've read stories, but I haven't seen any.
Okay.
If you see a lot of like small businesses and these little shops, yeah, we're temporarily closed. It could be permanent. I don't know. I see them as temporary until they're not.
Yeah, that's the thing. I mean, like I was sharing with you before we start the show, we lost what is easily our best restaurant in the area, and it had been around for 25 years. And they were open with it and just said the virus, we can't convert to a takeout model. That was their perception or whatever. And I mean, they're very successful business done, theater done, just saying, we can't make a go of it. We don't anticipate when it starts up again that we'll be able to, fill up a theater. There'll be some social distancing requirements. We're not going to make money if we're only letting 10 people in to see a movie. So there's things I'm starting to see just now in the last, couple days, and I'm thinking these will change our quality of life going forward. Like where I live, and thankfully I live, I guess, in the southern part of the state where we do have redundancy in a number of these things. But if you get to the northern part of my state, it's very rural. Like it's, you shut down a movie theater in the northern part of the state, it could be another 50 miles you drive until you get to another one. But I'm starting to see that, and I'm starting to make these comments of our quality of life will be degraded. Like we're not going to have the things around us, the small engine shop, the theater, the stuff like this that we had before March, those things. And people are going to be very hesitant to jump back in or maybe buy into those. So we're going to have to calibrate to this new normal. But yeah, it's interesting. You haven't seen that, up by you, but I guess you've seen some substantial layoffs. Is it U.S. Steel have made an announcement?
Yeah, my former employer, U.S. Steel, they posted a $390 million loss in the quarter, and they're starting to lay off. Nobody I knew that I work with directly that I still keep in touch with, they're fine for now, but I don't know how heavy industry is going to shake up because heavy industry makes the metal for cans,
right,
cars, you name it. So knives and forks, stuff we take for granted. And demand is collapsing on, at least on the consumption side of things. So what are producers going to do? And you're starting to see that. You're starting to see the effects now. It's sort of like it's almost like a ripple effect. Like it didn't happen right away. March 15th, U.S. Steel say, hey, we're going to lay off X amount of people. And it's just happened. I think the bigger the organization, the more momentum you have to go before you say, hey, mom and pop shop, small business, everything's shut down. State ordered it today. We're shutting down.
Right.
With bigger organizations, they can temper the blow for a while until something like this happens. And it's just I don't want to say natural. This is an unnatural event, but the natural course of things is kind of leading that. I don't to be a steamroll or a big snowball or what. I guess it depends on how the course of the virus runs. But even then, what's coming back and what's not, it's going to take a while. I guess I'm no economist or anything, but if you're going to collapse consumption and you're going to have 30 million unemployed in 6 weeks,
right? It's
going to take a while. It's going to take a while for it to recover naturally. I don't look at the stock market every day. I don't read. So it's just what I sense. It's the course of anything. You take a big shock, it's going to take time to recover. But have we hit that end part of the shock until we can recover? I don't know.
Yeah, I'm with you. I've heard a few states be really hesitant in talking about bringing back school K-12 in fall, for example, saying, yeah, we might do virtual. Like Pennsylvania is actually one of them. Connecticut, another one. A lot of universities saying we're not going to bring people back in the dorms because they don't want to deal with it if they have to shut down. They don't want to deal with that again. And so yeah, these massive structures, like where I'm at, I'm close to University of Madison. It's 40 minutes away, and on campus, that's 40,000 students who come in and populate Madison, and they're not there now. And come fall, a lot of those students aren't going to take the gamble on leaving their home and, getting a rental contract and all of this when they might be told in October, hey, the rest of the school year is online, face-to-face is done. Well, I could do that just as well as home versus, being here and paying my rent and doing other things. So yeah, I think we're in for a good 1 to 2 years of a shakeout. And everybody's kind of watching for this immunity too. Like, will there be some immunity from the university given to the universities, given, like if you have to switch online, you're not going to get sued by students? Because I've seen a lot of lawsuits in the last couple of days of students saying, I don't have the full experience of campus because, campus is so much more than just online. When I enrolled and paid my $50,000 a year for Drexler or whatever, I could go to all of these additional events which have been closed. So yeah, it's crazy. Now, so Chuck, you made it. When did you come to University of Pittsburgh? Because that wasn't too long ago. You made that career, that alteration in your career path to go to U of Pitt. Tell me, I guess, how that happened. So a little bit too, in putting the background on this, Chuck is someone who always looks to improve himself and then his opportunities. Is very much inventorying the opportunities before him, which we talk about in School of Errors, right? Inventory your options. And Chuck does that. And, he took this job at University of Pittsburgh, which right now puts him in high demand. He'll always be in high demand. But tell me about that decision-making process for you also, what you were doing before, why you went to University of Pittsburgh, why it was a great decision to do that.
It's been 21 months. That time
Wow.
has elapsed. 21 months, yeah. No, an opportunity presented itself before my U.S. Steel job. I did just a few months temp work with them, and after that assignment ended, I was back looking. I always kept in touch with those guys. They liked the work I did, and they said, "Hey, keep in touch." One of my old bosses, when I got the U.S. Steel job, he was like, "Hey, get this up, and then when you're ready, come on back." And timing, and it finally happened. If something interests me, I'd throw a line to them and say, "Hey, put a word in for me for it." And I did it one time this is quick. So I started in August of 2018, and July 2018, something interests me, and they say, "Hey, hold on, come in for something else." And so I did, and I started in August. I liked when I worked there initially. I just got a great impression. It was it was fun to work out. You're on a college campus, dude.
Right.
Yeah, you're on a college campus. You're working top 50 hospital in the country. I mean, there's prestige to that. And it was doing the work I was doing at U.S. Steel. Same thing. Take care of people's computers. Try to troubleshoot, replace, repair. And it was just a better environment. And it's just one of those things that, was the result of me laying a foundation I didn't know I had at the time. I was like, all right, great. This is, at least I have work for a few months. And it turned into within probably 18 months, from the time I quit that temp. That's U.S. Steel has been a time that I have been at, you see, and I don't know, maybe I'm a special case, but it's a case of, burn down the right bridges. All right.
Right.
If there's a job you're not satisfied with, and it's the people, and you anticipate going back, unless you really, really have to. The times are changing. You might have to kind of not set gasoline on a bridge on fire.
Right.
But I just but if you do, you like where you were, and even if it's something temporary. I remember the first, I don't know, half dozen years coming out of school, it was all contract work. I couldn't find any full-time. So I took contracts. And, you're going to find something you like. Go to 1099 route at first. Although It could be dangerous. They can terminate you at any time. I've had a contract that was on terminated. I was a young kid back then with a week left to go on the contract.
Oh, man, okay.
Yes, but, I mean, I go that route. That's how I managed to find a spot I'm in, and I'm going to be here for quite a while. I don't anticipate me moving at all. And I'm lucky I'm in the medical field, which is going to be in high demand until this is a wrap.
You got it.
And having to, work critical computers and, anything in that realm goes down, it affects, patients. It affects, doctors and nurses. So it's good to have that. It's good to have that. I don't want to say safety blanket, but knowing that, I'm going to be needed really helps out. So it's a combination of those two factors, finding where you want to go and finding a reason to stay where you're at.
Yeah, no, Chuck, that makes total sense. And I think you're reading the tea leaves completely accurate on medical. I would anticipate anything for the next 3 to 5 years that is medical related is going to get a lot of attention, not only from funding, from legislators, but we're going to have university programs recrafting. So we're going to have more nurses, nurse practitioners, doctors, so forth coming out. It's this thing called the Overton window, right? So the Overton window means what will be accepted for policy and legislation at a certain time. And right now, because of coronavirus, will we have, more funding for universities to train doctors and nurses? Yes, absolutely. Will we have more funding for hospitals to do telemedicine, to be more robust in those type of things? Absolutely. Like anybody campaigning on those as a legislator, home run right there with the Overton window. So you're definitely in the right spot at the right time because one, you love what you're doing. And the second part is you're doing it in an industry which is going to be front and center in the near and foreseeable future for funding. Even if we hit a recession, which I guess we're probably in, and a possible depression, even if we hit that, you're still in demand. And you're probably more in demand as we move more into telemedicine and so forth. So, I'm really happy for you. You've made the right decisions. You've looked at what's presented itself to you. So, Chuck, anything about how people, if they want to learn more about you or anything that you do that you want to share, any social media accounts?
No, I don't have social media. I've been off social media for a while. I'll comment and super chat in certain places, and I'm sure you'll find me there. I'll throw my 2 cents in if I want to give someone some cash. But outside of that, I have nothing for you guys.
Yeah, no, I like that.
I'm not the social type.
I'm not on Facebook, and people are always like pushing me. You should be on Facebook. I'm like, yeah, no, I'm good. And I'm pretty active on Twitter. It's like my one. And I got on LinkedIn like a year ago, and I found that to be pretty useless. I mean, it's a professional profile, which I don't really need because I'm retired. But yeah, the only thing from LinkedIn is every couple of weeks, somebody from LinkedIn is like, hey, do you want to see people who are viewing your profile? I'm like, no, I don't know. It doesn't matter to me. I'm not going to pay you $7 a month to see this. It means nothing to me.
Right.
But yeah, that's a good point. So to kind of wrap this up, it's Chuck Mack from Pittsburgh, giving us IT insight from the University of Pittsburgh Medical. Chuck's been on the show before. You can find that in the archives on the Safety Doc podcast. We walked through what it was like in early March when this whole cascade effect of bad news happened with the coronavirus event, what that looked like for Chuck. He was on a very critical role of scaling up the University of Pittsburgh Medical in capacity for potentially more patients, potentially in reality of more people working from home, telecommuting, telemedicine, what that looked like. some advice, we talked about. Chuck gave insight on your locus of control, what he has control over, what he focuses on, what's in the background for him. So it's been really, really a great conversation. Chuck is one of my member Chucks. And for those of you who haven't followed my work, don't know the member Chuck stuff, I wrote about it in my book. But member Chucks are people that you can go to all around the country, all around the world, who are going to give you authentic feedback of what's happening in their environment. They're also going to give you authentic feedback of saying, yeah, Dave, whatever you're saying, I don't agree with it, or I agree with it, or maybe you want to look at it in a different way. So when this was happening in its kind of most intense moments in March, Chuck and I would communicate on mostly a daily basis, and he would give me updates on what he is seeing, what he is observing, such as, the university has shut down. People aren't out in the streets. Here's a photo of the street by the university, which is usually bustling, and nobody is there right now. That I can trust. I can trust Chuck. I can trust that authenticity. So everybody listening, do that in your own environment. If you haven't done it already, face Validity. Find those people out there who will observe things in their environment and say, I observed, because that's much more powerful than say, I think. Well, I think this is going on. I think this is going on. I heard this on the news. I think whatever. No, get out there and be an I observed person. And I have a lot of respect for Chuck. Chuck is someone who is, very determined, knows his skill set, expands his skill set, takes the opportunities before him. So yeah, just a value-added person for the show and as a friend, Chuck Mack. So Chuck, anything else here for the Safety Doc podcast?
Well, thanks for having me. This one went a lot smoother than our first round. That was the first time I've been interviewed for anything, by the way.
Really? Okay.
In terms of something, yes. So yeah. So I learned a little more, and we covered a lot of ground here. And well, this is a kind of a situation where there's a lot of moving parts, and there's a lot of things going on, and things that have yet to be seen. And at least I was able to help you guys, see what I've seen on the ground. And I know I'm a unique case, but again, I've always I can only do what I can do. And again, thanks again for letting me share that with you. It's always appreciated.
Awesome. Well, everybody, this is Chuck Mack as a guest on the Safety Doc podcast. The Safety Doc podcast aired on the 405 Media out of Los Angeles, California. John Grant and the 405 Media, the League of Extraordinary Podcasters, Los Angeles, California. Check it out. But yeah, this is our good friend, Chuck Mack. So thank you, everybody. This is episode 133 of the Safety Doc podcast, always rendered in video, in audio, and then a corresponding blog post. 133 episodes, 150 hours of professionally produced content. School community safety, the best in the bizarre, making you better. Check it out here. Thank you so much.
What is my purpose?
You pass butter.
Oh my God.
Yeah, welcome to the club, pal.
This has been the Safety Doc Podcast with author, radio show host, and leading safety expert, Dr. David Perrodin. Remember to check back each week for the latest, best, and most bizarre practices in safety preparation and crisis response. You can find Dr. Perrodin on Twitter @SafetyPhD. And remember, the truth will keep you safe.